If you have a pinched nerve in your neck, you may feel a sharp pain that makes it difficult for you to turn your head. Or you may notice pain that spreads into the shoulder blade or even down into the arm. In either case, it can be incredibly frustrating. In this video, I'll share 5 simple exercises to help you relieve the pain fast. But first, it helps to understand what causes a pinched nerve. That way, you'll have a better chance of knowing which of the exercises might work best for you. The nerves in your neck come out of little spaces called neuroforamen. A foramen is basically just a hole. And when you sit with your head extended or in a forward head position like that, or when you tip your head towards the side that's painful, that narrows that hole or opening. And each nerve root has a specific pattern of referral, which you can see in the diagram. The nerves that most commonly get pinched are the ones in the lower part of the neck, specifically C5, which often refers to the shoulder, C6, which can refer down to the outer arm and thumb, and then C7, which refers down into the middle finger. Now, often those nerves get pinched the most because if you sit with a forward head, you've got a rounding in your upper back, and then you've got to compensate by hyperextending in the lower neck, which again narrows the spaces where the nerves come out. So things that would open up the spaces would be bringing your chin down into neck flexion or moving your head away from the pinched side. So now we'll get into the exercises. And the first exercise is actually a chin tuck, which opens up the spaces where the nerves come out, along with just a slight upper neck rotation like that. Remember that if you turn too far to one side, that can pinch the nerves on the side that you're turning to. And often people will have stiffness in the upper part of your neck, which causes you to turn more down in the lower part of your neck. And so if you can improve the stiffness in the upper part of the neck, you won't have to move so much and pinch the nerves in the lower part. So again, to do that, just do a small chin nod, bringing chin towards throat. Not necessarily chin down to chest, just chin back towards throat. And then just a small little rotation side to side like that. It shouldn't be a very large rotation. You're just going through a little bit of side bending and rotation just through this upper part of the neck. And that's where about 50% of your rotation comes from. Next, we're going to move towards side bending. And remember, side bending towards the painful side often narrows the spaces where the nerves come out and pinches the nerve more. So we want to go away from it. Now, this is one very common stretch that people do when they have a pinched nerve in their neck, is stretch their neck away. But often when you stretch your neck away like this, that pulls tension on the nerve root, which can actually irritate it a little bit more. So even though you're opening up the space where the nerve root comes out, if you overstretch like that, you can pull tension on the nerve root. So for this exercise, we're going to be a little bit more specific. Instead of thinking about moving your whole neck as one piece like this, we're going to think about moving just one segment at a time. So do a slight side bend that way, and you should feel a stretch up here if this is the side that we're treating. Then move down just a little farther, the stretch moves down to there, move a little farther, the stretch moves down to there, move a little farther. Now note that as you're side bending your head this way, you're actually kind of doing a little bit of a rotation of your neck as well. So this is both a side bend and rotation that helps to isolate the stretch a little bit more to one segment. Now once you feel like you get to the segment where you need it, then just hold that stretch for about 30 seconds or so. Now if you don't quite feel like you're getting to the right area, you can also modify that by taking your hand and putting it on the top of your head and then just doing a little compression through the top of your head. So you're not pulling over like that, you're actually pushing down here. So slight tip, push down, and you should feel the stretch up there. A little more tip, push down, feel the stretch right there. A little more tip, push down, feel the stretch right there. A little more tip, push down, and you feel the stretch right there. So adding that compression just makes the stretch a little bit more specific. So those first two exercises were very specific segmental stretches. Now we'll start to move a little bit more into larger movements. For this next one, you'll take a towel and roll it up like a log, and then just place that around your neck like this. Now, if we're going to try to improve turning towards this side, if this is the painful side, we want to improve rotation of the segments above the painful area. And so we're going to grab with the opposite hand and reach across. So cross over that way, reach over top with the side that you're turning to and grab the towel. Then you're going to pull it along your cheekbone. With this hand down here, you're pulling down. That helps to stabilize, and then just coming across using your upper hand to guide. Now, it's very important when doing this just to go through a range of motion that you can comfortably. If you start feeling an increase in pain, and particularly if you start feeling more pain in your shoulder blade or down your arm, you want to stop the stretch or just not go as far. So this should not irritate the problem any further because, again, we are kind of turning towards the painful side in this one. So just going like that. And with this one, I wouldn't necessarily hold it. I just kind of go back and forth for about 10 to 15 repetitions, maybe holding a second or two at the end, then coming back to center and repeating. Now, the next exercise, you can also use a towel. However, I prefer to use either a stretching strap, a dog leash, or a long belt. Regardless of what you use, you want it to be long enough that you can sit on one end of it with your bottom and then pull the other end up over your shoulder. And again, we're pretending this is the painful side. So for this, we're going to do a side bending away from the painful side, but we're going to use this strap here to pull down on your first rib. Many people don't realize that your ribs go all the way up to just below your neck. And so your first rib is right here. Now, when your neck muscles, specifically your scalenes, go into a spasm, they can pull that first rib up, and the first rib can actually pinch nerves between that first rib and the collarbone. So for this one, you're going to take the strap. Again, you're sitting on one end, then pull it across you like a seatbelt down towards your opposite hip. Once you get the pressure here, then you're just going to pull down that way, and you want to keep a pressure down on the rib right there. So pull down, cinch that down really tight, and then just tip your head over away from that side. What that does is it helps stretch out the scalene muscles without creating excessive stretch on your upper trapezius, without tensioning the nerves too much, and without pulling the first rib up to further pinch the nerves. So again, place this close to your neck, tip over to the side, and just go till you feel a little bit of a stretch right there. If you feel the stretch all the way down in your shoulder, down there, you're probably going too far. For the last exercise, you're going to put your arms up like this, raise your arms up this way, and then shrug your shoulders up while keeping your chin tucked down. What this does is shortens your upper trapezius muscles and takes some pressure off of the nerve roots. Oftentimes, these muscles will feel tight or tense, but if you look in the mirror, the painful side is often lower. What that does is compresses the vertebrae together and pulls tension on the nerves. So even though they feel tight, the muscles may actually be over lengthened. And so rather than further stretching them, we need to shorten them. To do that, again, put your arms up parallel with each other, raise them up, then do just a little shrug of your shoulders up like that. Hold for 10 seconds and then come back down, and then repeat that 10 times. So those were the 5 exercises. Leave a comment letting me know which ones you like the best. And if you'd like more tips to relieve neck pain, check out this playlist over here. But before you go, if you found this helpful, give the video a like. And if you haven't already, subscribe to our channel so you don't miss out on future tips. Thanks for watching, and I'll see you in the next one.